All right, this is an anatomy of the heart video. Hopefully this model will suffice. You'll see that it comes apart in different segments that we will open up and take a look at. It is a little big, so bear with me if I'm trying to maneuver it. We're going to look at the underside, and I'm going to have to take it off, so the camera will go a little haywire when I do that. So we'll just start with the outside main structures and work from there. We'll probably end with the vessels, and yeah, so here we go. So what you're looking at here is the anterior portion of the heart. Okay, the heart actually sits points, I should say, anterior, inferior, laterally. Okay, so this is the apex of the heart that will be pointing in that direction. Okay. So the heart is arranged into 4 different segments. Okay, you have 2 atria that are on the top, and then you have 2 ventricles, which are on the bottom. So before we go into what's what, just really briefly, probably already know this, blood goes into the right atrium. Okay, it looks like you're on the left, but again, we're looking at the front of the heart. So realistically, the heart would be pointing this way. Okay, so this is the right atrium up here. The blood will then pass into the right ventricle. It will come up through this structure here, okay, which I'll talk about in a minute, and come out here, and it will go to the lungs, okay, both on the left side and the right side, and then we'll come back around. It will and enter the left ventricles, the left atria through here, and we'll go into the left ventricle, and then it will come up behind here, out this structure, and to the rest of the body, and as well as out of here, going superiorly. Okay, so let's kind of start going over anatomy in the direction of the blood flow. Okay, we'll cover that. So blood is going to come into the heart from the superior vena cava, okay, big vessel down here, and the superior vena cava up here. It's going to go into the right atria. All right, we're going to open this up. Okay, so this is looking inside of the right atria. Okay, so excuse me. Let's see. Thing to know about the atria here. Okay, with this little divot right here, this part is kind of important. That's called the foramen, or excuse me, the fossa ovalis. Okay, in a non-fetal heart. If it's a fetal heart, it is the foramen ovalis. There's an actual hole there. And the reason that is obviously the baby is, inside amniotic fluid. And it can't not suck in fluid. So the lungs are actually non-working in a fetal baby. So what happens is the blood will actually go through here and directly into the left atria in here, okay? And from there, it will go into the, down to the ventricle, and then the blood will go to the body as needed, just like normally. So basically all that's really happening is it's bypassing the lungs. The lungs are deflated. Okay, that's why when the baby comes out, it's not crying or anything. You need to get the baby to cry, and then those lungs expand. That's what you're trying to get to happen. Okay, and that's also why it's safe to do things like water births. Okay, the prenatal infant's lungs are not working at that time. Okay, so it will go through this valve down here, okay, which is called the right atrioventricular valve, okay. Okay, and this is coming through this valve down here onto the right ventricle, into the right ventricle, okay. So what happens is you have these cusps, okay, and oh my gosh, I am totally just drawing a complete brain fart. I cannot remember if that's the bicuspid or the tricuspid. Let's see. Yeah, I can't recall. Okay, I should definitely know that. Actually, let me see this. Okay, yeah, so it's the tricuspid valve. Okay, so this is called our atrioventricular valve. It's tricuspid, and what we mean by tricuspid is that it's got three flaps. Okay, what told me that this is definitely the tricuspid is the fact that there are three sections. Okay, these little sections, these white strands coming down, are called chordae tendineae. Some people pronounce it chordae tendineae. I say tendineae, and they connect to little muscles. Okay, and these are called papillary muscles. Okay, so the papillary muscles are activated by the electrical system in the heart, and they actually pull on this valve, and they, kind of opens. And that's actually part of the lub-dub sound that you hear in the heart, is these opening. Okay. The second sound in the lub-dub, what you're hearing, are actually one of these valves. Okay, this is one of the semilunar valves. You have one over here too, I'll go over. But this is the pulmonary valve. Okay, by semilunar, it's also called a semilunar valve because it's got this part here. It kind of looks like a half moon. So the blood will go from the right ventricle up through the pulmonary valve and into the pulmonary artery. Okay, now you probably already heard this before, but we'll go over it just in case. You see that this is blue. We're used to seeing blue as deoxygenated, or excuse me, as a vein. But in this case, it's an artery because it's going away from the heart, but it is blue because it is deoxygenated, okay? So it needs to become oxygenated, okay? So this is the rare case, the only case, as far as I know, that an artery has deoxygenated blood, okay? So it's gonna go to the pulmonary trunk, and it's gonna go this way and behind the superior vena cava out here, right here, okay? And those are your left and right pulmonary arteries, okay? And as I mentioned, they'll go to the lung, they'll pick up the oxygen through the alveoli, and will come back through now they've received oxygen, and they're going back to the heart, okay? So it's a vein, but it's red because it has oxygen, okay? So remember, pulmonary trunk and arteries and the pulmonary veins are backwards, okay, in what you would normally think. Okay, so it's going to go through the pulmonary veins that are red, and it's going to go into the left atria, okay? Now, it doesn't show it on here. You see these two dots, that's just the entry point for the, what would it be? The right side of, okay, the right pulmonary veins, okay, coming in that way. But I don't see the foramen ovale, which is, it's not showing in here, but it would be coming through here, okay? And it will go through the left atrioventricular valve, okay? Now, this one is a bicuspid valve. It has two sections of chordae tendineae as well, and two segments for papillary muscles that will pull on it. It is also referred to, what you might have mostly heard when talking about this, is the mitral valve, okay, same thing. The blood will then go up through this white structure. You can't really see it. Maybe you can see the slight number right there, that 45, okay. That's another semilunar valve, okay, and that is called the aortic valve, okay. So the blood is gonna come, and that's coming out here through this really big vessel here. So the blood has oxygen, and it's going through the ascending aorta, the aortic arch, and then the descending aorta, okay? And that gets into the thoracic aorta and the abdominal aorta, eventually goes down to the legs and what's called the left and right iliac, okay? And then eventually the femoral artery, okay? That goes clear down. And you have these three branches coming off up here, okay? This is called the brachiocephalic, and this is the left common carotid, and this is the left subclavian, okay? The brachiocephalic actually separates on the right side of the body into these two vessels right here, okay? So the difference is this one's coming up here, and then it bifurcates into a right common carotid and a right subclavian. And this one just has the subclavian and the left common carotid coming straight off of the arch, okay? So the subclavian, it's going to go to the arm. Common carotid is going to go to the outside of the skull and on the inside. That's another bifurcation into the left and right, external and internal common carotid arteries, or excuse me, not common. This is the common. It bifurcates into the external and internal carotid arteries. Okay. And the brachiocephalic separates into these two on the other side. All right. Hopefully that's making some sense. Okay. Let's see. So it's going to go through the body. All right. So we've looked at that through the passageway of the blood. I also want one other thing that's worth mentioning, actually, when it comes to the fetus. Okay. There's actually a backup because blood actually, because like I was saying, blood comes in here. It's supposed to go through the foramen ovale here, but it is possible for some blood to get through the right atrioventricular valve. And if that happens and it comes up here, you have a secondary pathway here. Okay. Now inside the fetus, this is called, give me a moment, see if I can try and pull it out of my head here. The Sylvalis door. Ligamentum arteriosus. Okay. In an adult, it's the ligamentum arteriosus. Okay. It becomes kind of a ligament structure. In the infant, it's called the ductus arteriosus, okay, because it's a duct, it's got an opening. So blood will pass from here and into the aorta rather than into the lungs. So it's kind of just a backup to make sure the blood isn't trying to make its way into the lungs that have deflated, okay? Inside the mother, the placenta actually really serves the needs of the lungs, okay? It's basically the lung for the infant. Okay, let's close these up. It's on the outside. It's also worth mentioning, I kind of mentioned this is the backup for blood in the fetus. In the human, you have these two structures, kind of look like fat in real life. You have one here, and they are your left and right auricles. And they're actually pouches, even though on this model it just looks like a flap. In real life, they're actually pouches that kind of have, like if this was an actual cadaver, you would see a pouch inside here, like a pocket. So it would allow more blood. So if too much blood is getting into the heart, congestive heart failure, hypertension, things like that, it just allows for a little bit more space to feel so the atria doesn't become overburdened. Okay. All right. So let's go over the vessels on the outside here as best I can. So this here, well, as blood comes up through the aortic valve inside the heart, it's going to come through the aortic arch. But right when the aortic vessel, okay, or artery begins, you have this coming off right here, okay? And this is your right, man, it's totally escaping me, gosh, right coronary artery, okay? The left coronary artery is here, but it's underneath the pulmonary trunk, so you can't really see it here. But the right coronary artery comes down, okay? And you have a marginal artery, okay? This is the marginal artery. The marginal arteries separate the anterior and the posterior sides of the heart, okay? So it's marginal, it's separating, okay? The left coronary artery, which you can't see, okay, comes through underneath this pulmonary trunk, and it comes out right here, okay? And it bifurcates into what is called the coronary circumflex. Some people say circumflex artery, but there are other circumflex arteries in the body, so you need to remember coronary circumflex, okay? It applies to the heart here. And it's also going to come down here into the anterior interventricular artery. Okay, so anterior on the front of the heart, it's in between the left and right ventricles, so interventricular, anterior interventricular artery. So the coronary circumflex artery comes around the left side and comes down here. You kind of see this. So this is this artery, just looking at the red, not the blue, is the left marginal artery, okay? Again, that's separating the posterior and the anterior sides. I am going to try and take this off. I mentioned earlier that I was going to have to take this off. Okay, so this is on the back side. So this is the posterior interventricular artery. Posterior interventricular artery. Okay. Okay, as far as arteries go, that's probably the only one worth mentioning. Now, with the veins, this right here, this big bulb structure is called the coronary sinus. Okay. That is a collection point of the blood to enter the right atrium. Okay, so remember we talked about the right atrium receives blood from the superior and inferior vena cava. It also receives blood directly from the heart itself. Okay, so blood will pass through the aorta into the right and left coronary arteries. Okay, and it will go to where it needs to supply the heart, go through the vein structure, end up here at the sinus, which will then enter again into the right atrium. Okay. Coming from off of this side, this is the great cardiac vein, and off of this side, small cardiac vein. Okay, kind of easy to tell why those are named that, just looking at the size. Okay, interventricular vein. Okay, let's see. I think, yeah, those are the only major ones that I can think of. All right, let's see if I can actually get this back up here. Let's see. So, okay, so you can't really see it on this structure, but it's also worth mentioning the electrical system of the heart. Okay, so the electrical system of the heart starts with pacemaker cells, and it begins in sinoatrial or SA node. Okay, and that's up near the superior vena cava on the right atrium. Okay, again, it's not showing here. I'm just kind of giving you an idea of where they are. I wish I had a model that showed it, but I don't. Then it's going to go down to the bottom of the right aorta, and there's going to be an atrioventricular node, okay, the AV node. It will travel to there. Oh, you know what? It's also worth noting from the sinoatrial node, it also passes to the left side of the heart, the left atrium, via what's called the Bachmann's bundle. Okay, so electrical current is going this way. It's also going this way. Okay, because the atria are going to pump at the same time. Okay, and then the ventricles are pumping at the same time. So it's going to start in the sinoatrial node to the Bachmann's, and they're going to pump at the same time. And then it's going to go to the atrioventricular node. And then from there, it's going to go into the bundle of His. It's like a thick nerve fiber, and that's going to separate into the left and right bundle branches. Okay. And the bundle branches separate into what are called Purkinje fibers, and those are just a multiplicity of nerve fibers that will come down, wrap back up. Okay, so sinoatrial node and Bachmann's bundle, same time, down to the atrioventricular node. Bundle of His is going to separate the left and right ventricles. Okay, and then Purkinje fibers is going to come back up this way. Okay, that is the path of the electrical current. Okay, so again, with the lub-dub sounds you're hearing, that is the pulmonary and the aortic valves. Okay, that's one, and then both of the atrioventricular valves, that's the other, and those sounds are those valves opening and closing. Okay, let me think for a minute and just make sure that nothing else comes to mind that I might be forgetting. Okay. Yeah, all right, I can't think of anything. So I think we're going to call it there. Hopefully you learned something. Thanks for listening.